On a recent InTouch Health webinar, Deborah Philpott with TriStar shared tips on how her team overcame some challenges while expanding telestroke and telepsych programs. Deborah said one key aspect to rolling out any telehealth service, it's consistent documentation.
And we had, in the beginning, just to tell you a little bit of the journey in the stroke world, we had developed our own clinical note, and it was getting fax mail to the hospitals. And it was actually a very good note, but then we still had some providers who were dictating, and we really had a hard time analyzing our effectiveness and our documentation consistency because it truly was all over the place. And we went to a unified note through the clinical applications as a part of the software. That physician team that we meet regularly, they actually were extremely involved in establishing the layout, the flow, the content. And so because they were invested in it, I think we've had great success at the adoption of a consistent note. And again, it makes it extremely helpful for us to identify any variation in clinical practice because we have visibility and access to every single one of these consult notes. We have done a very similar thing, and this is actual screenshots of the clinical notes, but instead of for stroke, it's for our behavioral health. And this is just a screenshot of a helpful tool that we've had to, again, have consistency in the documentation. And it's really laid out just like any other H&P would be.
Deborah also took some time during the event to discuss how they addressed training challenges. And if you would like to hear those comments, you can access the entire archive of the TriStar webcast by simply visiting intouchhealth.com and click on the telehealth resources link.